welcome to my YouTube channel. My name is Sophia, and on this channel we talk about health related issues in toddlers, babies and children. Today we're talking about how to relieve baby and toddler constipation. Before we go into our topic for today, if this is your first time coming across the channel, please do it to subscribe, like and comment. Leave a comment, and most importantly, do it to subscribe so if there's any new video, you'll be the first to know about it. Back to our topic, how to relieve baby and toddler constipation. If you are like many parents, you are all too familiar with your child's poop, like when they are green, when they are runny, and when they won't come out. Yes, even little ones who eat a healthy diet can come down with a case of baby or toddler constipation, although too little fiber is a typical cause of this potty predicament. Though your little one may not be able to tell you that her tummy aches or her stools are stuck, if she's straining and passing hard stool balls, you might have a constipation issue on your hands. The good news, baby and toddler constipation are often easily treatable, and your little one can be regular again before you know it. Next, we'll be looking at how to tell if your baby or toddler is constipated. It is easy to worry if your little one hasn't had a bowel movement in a day or two, but fewer poops than usual aren't necessarily a sign of constipation in babies or toddlers, provided the poops that do come out look normal and your sweetie seems comfortable. In fact, it's more about the consistency of your child's stool than the frequency. So how can you tell if your baby or toddler is constipated? 1. When the poops are small, hard, and hard to pass. Constipation poops look like small, hard, dry pellets. Your child will probably pass them less frequently than normal, and toddlers might grunt or scrunch their faces while they are trying to go. Briefly straining, turning red face, or even crying when trying to poop aren't necessarily signs of constipation in infants, though since even regular bowels can be tough for babies to pass. Constipated poops can also be accompanied with blood, which can come from anal fissures, cracks, or little tears that form as a result of hard straining. 2. Stomach ache or crankiness. Babies and younger toddlers might seem fuzzier and crankier than usual, while an older toddler might also tell you that their tummy hurts. Babies might speed up more often than normal, while toddlers might have less than their typical appetite. 3. You have infrequent poops. The time between bowel movements depends on things like age and diet. It's within the realm of normal or exclusively breastfed babies to go several days without pooping, since their bodies sometimes use up every bit of breast milk for energy. On the other hand, formula-fed newborns usually have one bowel movement most days, but they might go a full day or two without pooping. Now we go on to how long can a baby go without pooping. Once again, if you have come this far with us, please do it to subscribe, like and share your comments below. How long can a baby go without pooping? In some cases, longer than you might think. While many little ones poop every day, it's possible and not necessarily something to panic about. If she often goes 2 or 3 days in between, constipation might not pop up on your radar unless she's been bowel movement free for 4 days. But if your child normally goes like clockwork every single day, you might watch out for signs of constipation after a day or two without poop. So the summary of this is that every child is different. Pay attention to what's typical for your little one. Next, we'll be looking at how to help constipated babies or toddler. Constipation doesn't just make your little one miserable. It can get worse when left untreated, making it even harder for your little one to pass through. So if you suspect constipation is the cause of her discomfort, take quick steps to get things moving again within these tips for baby and toddler constipation relief. We'll be giving you some tips on how to relieve a baby or toddler of constipation. Number 1, pay attention to the calendar. You should call the doctor if your formula-fed newborn baby seems uncomfortable and fuzzy and she hasn't pooped for several days, or if there's a change in her bowel habits. You should also call if your older baby or toddler hasn't had a bowel movement for 4 or 5 days. Constipation is rarely an issue for exclusively breastfed babies, but if your little one seems to be going longer than normal without a poop and you are concerned, there is no harm in checking in with the doctor. You should call the doctor too if your baby or toddler's constipation is accompanied by bowel pain or vomiting, if there is blood in her stool, or if at-home measures to get things going aren't working. Now the following should be put into consideration. 1. Skip the laxatives. Laxatives can be dangerous for babies and toddlers, so never give your child one unless your doctor has given you explicit instructions to do so. In the majority of cases, simple at-home measures should be enough to help your child poop. That said, when the below measures aren't working, polyethylene glycol is often suggested by pediatricians to help get things moving, but again, only give it with your doctor's approval. Number 2, offer more fluids. Older babies and toddlers should get at least a quart of fluids a day, but if yours was recently weaned, she could be getting less. Water is a good option for babies older than 6 months, but 100% fruit juice like apple, prune, and pear contain sugars that could also get her bowels moving. Talk to the pediatrician about giving juice to babies under 12 months as a constipation remedy. Otherwise, they shouldn't have juice at all. Toddlers 1 year and older can only have small amounts. As for options like grape water, some parents swear by the stuff for tummy troubles, but there is no proof that it can help with constipation. Be sure to check with your pediatrician before offering grape water to your baby. Number 3, bump up the fiber. It can help to move food through the GI tract faster, easing constipation. Fresh, soft fruits and vegetables cut into small pieces with the skin off, like poached pears, kiwi, and pureed peas, and soft cooked, minced or pureed dried fruits are good choices for babies who have started solids as well as toddlers. Try to avoid refined grains like white bread, white pasta, or baby cereals that aren't made from whole grains. They are low in fiber and tend to slow things down. If cheese, meat, ice cream, or processed foods are part of your child's diet, steer clear while you work on the plumbing issue. Number 4, get moving. Physical activities get your little one's digestive system going. Try not to have your baby or toddler sit in a carrier, stroller, or car seat for too long, and offer plenty of opportunities for movement and play. If your baby isn't mobile yet, bicycling her legs is a good option. Number 5, try probiotics. The beneficial bugs are thought to help curb constipation and promote regular bowel movements. Offer plain yogurts containing live active cultures, or ask your doctor about giving your little one a probiotic supplement. Number 6, get help with lubrication. A dab of petroleum jelly applied around the anal opening could help to slide out more easily. Constipation is a common childhood ailment, so there's a good chance your baby or toddler will deal with it at some point. Thankfully, the issue tends to be easy to fix with at-home measures. But if you're having a hard time getting things moving, or have questions on how to cope, or if constipation seems to be a chronic issue for your child, it's always worth putting a call in to the pediatrician. Thank you for watching. I hope this helps. Please leave a comment, subscribe, and like. Thank you. Bye-bye.